It does make healthcare professionals quite reluctant to want to engage in medical cannabis, because I think often they struggle to look past the stigma and actually see the medication and the benefits of it.
Patiently waiting. Ahead of Drug Science's UK Patient Conference on the 3rd of November, we catch up with Sarah Sinclair, editor of Cannabis Health, and medical cannabis patient Berta Kaguako. Both will be speaking at the conference, focusing on topics of improving access to medical cannabis more broadly and increasing the number of NHS prescriptions. Let's get a flavour of what's to come. Good morning, hello, and welcome to the Lobsterpot podcast. I'm Dave Barton, and I am the co-founder of Thermidor, and this is the Lobsterpot podcast. And Jamie Bonthron, he is the other co-founder of Thermidor. How are you doing today, Jamie?
I'm really good, actually. Sun's just come out for about the first time in what feels like about 8 years. And I know we always talk about the weather when we do an intro, but
we are British.
I want to actually brag about that for once because it's making me feel better.
Bragging about the sunshine. It's not something you can do every day here,
Really
but it's all good. But today we have not one, but two special guests. We have Sarah Sinclair, who is the editor of Cannabis Health, and she's going to be chairing some of the discussions at the upcoming UK Medical Cannabis Patient Conference next week on November the 3rd. Good to see you, Sarah. And we have a patient and healthcare consultant as well, who's also going to be at the conference. So we have Berta Kaguako. Good to see you both. How are you doing?
Bye.
Hey, good, thank you.
Excellent stuff, excellent. Cool. So, Sarah, let's come to you first. So, the conference, what can we look forward to? What's going to be going down? What are you going to be doing? And just give us a bit of a lowdown on what to expect for those who haven't been to one before.
Yeah, so I've been kind of working with Drug Science on the patient conference. It was the first time this happened last year, and the idea behind it was a collaboration between Drug Science and Medcan Family Foundation to sort of address a unmet need, I guess, in the industry. We have kind of these very conferencey, businessy events, which are very like suits and very professional. And then we have sort of the more recreational focused events, which are obviously great, but it felt like there was a need for something in the middle to kind of bring patients together and provide a space to share experiences, share stories, and hopefully bring in other patients who want to learn more about it to kind of help them on their journey. So yeah, hopefully it will be kind of building on what happened last year. I felt like last year I wasn't sort of hosting, but I was like kind of there taking notes all day, and it was just a great vibe, I think, of kind of people coming together with this shared love of the plant and the benefits that it has on kind of an individual level, but also for the wider community. So very much kind of building on that this year. And yes, there'll be lots of discussions on kind of what, obviously we're coming up to the 5-year anniversary of the law change next week. So we'll be reflecting on the developments, the progress, or you might say the lack of progress over the last 5 years, and looking forward as well to the future in terms of what cannabis healthcare looks like. And also I think we're going to have some discussions around kind of what, as an industry, what we can do to sort of to grow and address the sort of need to engage patients outside of this existing cannabis community that we've got. So we're going to explore some of those things, and I won't give it all away yet. We can dive into that later.
No, that's awesome. And I think, in terms of where we're at right now, depending on which numbers you listen to, and again, it seems to fluctuate wildly. What are we, 100,000 patients in the UK or thereabouts? And we're a nation of 67-ish million. That's nothing. Well, it's not really a dent, is it? Tell. What do you think? What's your take on this?
Yeah, well, it's actually, so it's 140,000 prescriptions, but patient numbers are actually, I think it's still around 30,000, maybe like 32,000 now.
Right.
So in terms of the patient numbers, we're actually way down.
Okay.
But yeah, and those 140,000 prescriptions, that's from November 2018 to November 2022, I think, is the latest data that there is. So yeah, there's, I guess you could say that there was not that much progress had been made, but again, that's still 32,000 patients that have been able to sort of access a treatment that's hopefully been really beneficial. So
100%. And as one of those patients, Berta, tell us a little bit about your sort of experience of, being a medical cannabis patient and working in the sort of the healthcare sector. Tell us a little bit more about your experience.
Hi, my name is Berta. So my background is I initially started my career as a children's psychotherapist, and I mostly worked with trauma and abuse. And then I moved on to working in the substance misuse sector. That's where I sort of developed my senior management skills and developed into um, managing health and social care sectors, and then moved on to managing children's care sectors before moving on into consultancy and um, recently being the CQC registered for manager for a medical cannabis provider.
Oh, wow.
And my experience in medical cannabis is I'm also a patient. I've been a patient since, I think, since the onset, really, of medical cannabis. One of the reasons why, I mean, in general, one of the reasons why people can access medical cannabis, or what was something of a criteria prior to the criteria changing recently, was that you would have had to trialed and failed two conventional methods, meaning that you would have had to gone through the system and trialed a variety of different things before you were approved. Therefore, a lot of the patients would essentially be complex needs patients, because they've got, in some cases, quite severe clinical unmet needs. And in my case, when I developed COVID, I mean, I've always had diagnoses, but when I developed COVID and long COVID, it flared up all of my diagnoses, which is fibromyalgia, arthritis, hemianesthesia, which is slight loss of sensitivity on the left side of the body. And it's the entire left side of the body. And sometimes it can be, it can go paralyzed, bilateral sciatica, a history of Morton's neuroma, and as a result, a sirens on the C6, C7 of my spine. I suppose asthma. Not that that's really relevant, but it's quite a long list and ongoing, and I'm still having a variety of different interventions via the NHS. But one of the main reasons why I decided to start speaking out about medical cannabis is because of my experience working there and discrimination that I felt that a lot of patients experience, which, for me as somebody who went from being unable, I mean, I'm not sure how much time I have. Do you want me to go through some of?
No, that's cool. No, tell us more.
Yeah, so I tried a variety of different things. Sometimes I do a bit of physio, I do some massage, I do yoga, I go to the gym, I take my vitamins, I diet. You do the regular things that you need to do in order to take care of your health. But unfortunately, sometimes you can be quite crippled by a lot of symptoms. And I think often people associate pain with just pain. But the reality is that not only are you in pain in practically every fiber of your being, but you're also nauseous. Sometimes you're vomiting. Sometimes you've got IBS. Sometimes you get a bit of a locked jaw where you're unable to speak. And a very bad toothache. I've got loss of teeth. You get ulcers and blisters in your mouth, and you get a skin that is sort of like scaling and peeling off sometimes. A lot of memory loss, so you'll probably notice me going a lot of the time, or asking the same question often, because I will forget. You have loss of appetite. There's been periods where I've been a size 6 because I've been unable to physically eat, and I've had to force protein shakes down me just so that I can have something inside of me. You get confusion, migraine, hot flashes, dizziness, fainting. Swelling. I mean, if I'm going to be honest, the list goes on. It's not just the pain, it's a lot of other things associated with the pain. And often when it's just pain, it's something easier to deal with. But when you have all the other symptoms, it becomes unbearable. And you're often found bedbound for about 2 weeks, sometimes a week. And although before I was taking medical cannabis sporadically, from 2001, I started taking it more regularly, and I've noticed that I've been able to replace a lot of my medication and take a lot of the NHS medication much less. I've noticed that I'm able to at least present like a functioning human being, even though I might forget this conversation in about 10 minutes time. I am able to work again. I'm able to socialize again. I'm able to travel. And yes, I have lots of limitations. I need lots of breaks. And I do rely on medication. But at least I'm functioning and I've got some form of quality of life, which a lot of our patients do benefit from. And I felt within the industry, it was quite heartbreaking to see a lot of our patients struggling to advocate for something that is their legal right. And, not to be all political about it, but they have freedom of choice and freedom of speech. And if they feel that conventional methods aren't working for them, then they should be able to trial another medication. And one of the things I suppose that we're going to be discussing at the conference is some of the barriers for patients and looking at some of the stigma so that we can start, and I suppose so that we can start looking at medical cannabis in a much more different way. I know it's associated with substance misuse, and I do consultancy in that sector. I'm very familiar with substance misuse. I wouldn't be advocating for medical cannabis if I thought that it was extremely dangerous and highly addictive. And I do work with illicit cannabis users, and I know the difference. And I suppose I want to share a lot of, my experience, some of the barriers I've experienced, to try and promote medical cannabis to naive patients and potentially even patients now to improve on their existing quality of life.
No, I mean, wow. First of all, I mean, thank you for sharing. I mean, but again, it goes to show that someone who's still very well informed on cannabis and the use of it, and obviously benefits from it a great deal, you're still very aware of the stigma. And I'd like to ask, I mean, what do you feel is the real, I mean, is it still a lot of stigma, or is it kind of the cost that's sort of holding people back, or is it or is it the NHS not being able to kind of prescribe it, and you need to get that sign off? Is it a kind of combination of all of those factors do you think are really inhibiting the kind of uptake of medical cannabis by a broader number of people? Because I'm sure more people than
a lot more
people could benefit from it. Absolutely. So
I mean, I believe it's a combination of those and more. Obviously these are stuff that we are going to discuss at the conference, but I suppose one of the biggest ones is always stigma. In the UK, the recent census done in 2022 reveals that I believe 7% of the UK population illicitly use cannabis. That is 4.6 million people. So you can understand from a substance misuse perspective that prescribers or healthcare professionals are quite reluctant to engage in something. And just to clarify, illicit cannabis is the number one substance misuse in the UK, followed by followed by cocaine. But I'm not going to go too much into substance misuse. This is not what this is about. Just to give you an idea that a lot of people misuse cannabis, and as a result, it does make healthcare professionals quite reluctant to want to engage in medical cannabis, because I think often they struggle to look past the stigma and actually see the medication and the benefits of it. For some people, of course, like every treatment, sometimes it doesn't work for some people.
But I guess it's that idea of misuse as well, and what that means. I mean, we talk about misuses and people are self-medicating, or what in terms, what do you define as that? Yeah, recreational.
Recreational use. Yeah, it could be for a variety of different reasons. It could be self-medicating, it could be peer pressure, it could be for fun, it could be out of curiosity. There are a variety of reasons why people use. But the interesting part about this census, and honestly, anybody can Google it, is that it was done in a 9-month period. So bearing in mind, these figures are from 9-month period, and these people had been misusing recreationally for about roughly two or three, maybe don't quote me on that one, but roughly 2 or 3 years time. And I thought, and of course, it increased during the pandemic. As you're aware, mental health increased during that time. Therefore, did substance misuse because more and more people were self-medicating. But it's interesting that this isn't anything new. This is something that has increased, yes, but it's nothing new. And, illicit or recreational, whatever you want to call it, use has always been around. It's associated with a lot of negativity. It's associated with poverty. It's associated with delinquency, crime. As a result, again, a lot of healthcare professionals do feel a bit nervous when it comes to medical cannabis, and often don't even give it a second chance. They just overlook it and say, oh, this person is just trying a medication seeking behavior. And, that's the end of that story, which is really sad. I don't want to talk too much. Sorry. I think
not at all.
Super helpful.
I was just going to say, I think you touched on the sort of fact that, a significant amount of those people are self-medicating. I think it's 1.8 million sort of estimated are self-medicating with cannabis in the UK. And then I think it's interesting that obviously increased in the pandemic because people are using it for mental health reasons. So, potentially even more are self-medicating. Yeah. And I think the industry does tend to focus on that 1.8 million a lot. But what I hope to explore a bit more at the conference is how we can kind of get out of that sort of that community and reach those, like you say, who are cannabis naive, who still are not even aware that it's legal. I think something like half of the population don't even know that medical cannabis has been legal since 2018. We want to sort of address what we can do as an industry to improve how we're communicating about this and help engage those people that might be a bit hesitant about it or might have this stigma attached. And we'll actually have some representatives from charities there on the panel. We've got someone from Parkinson's UK and Lobsterpot UK who are going to sort of talk about their experiences and their views. And I think having those outside perspectives are really important for kind of moving the conversation forward.
Yeah, definitely.
Leads into what I was going to ask a little bit. And when we started talking, Sarah, you mentioned, you said, I think it's still 30, 40,000 people that have been helped. And I think that's quite a positive outlook. Dave and I openly kind of poo-poo quite often, like uptake and how slow it's been. I'm sure it's something that frustrates a lot of people in the industry. And I think it frustrates people in the industry because they know how much good it could do.
Yeah.
I guess broadly speaking, are you, maybe a question for both, maybe start with Sarah, but like, are you kind of positive about, where it's headed? Do you, like, broadly speaking, are you quite excited about the trajectory and what you think is capable of the industry delivering, I guess?
Well, that depends what day you ask me that question, to be honest. I think it's hard. It's a hard industry to be in right now. And it is quite easy when you're working inside the industry to be frustrated at the lack of progress that's being made. And, I think a lot of companies are struggling financially and it is really tough. It's, I've been doing this for kind of over 3 years now. And some days you do think, like, why am I even doing this anymore? We're not actually getting anywhere. But I'm looking forward to the conference because I think it's hopefully going to be a reminder of actually like the positive benefits that have come from it, even if we're not as far along as we want to be. Kind of being in that room with everyone and hearing these stories, I'm hoping for me it's going to be a reminder of like, oh yeah, like this is why we keep doing this and this is why we keep talking about it and having the same conversations. Because if you're just that individual person like Berta who's kind of living with those complex conditions, I've got a chronic illness myself, it can be like a completely life-changing treatment. And that individual person, then goes able to sort of work and engage in their community, they can provide in the economy. There's so many much wider benefits that are not being recognized, and I just hope we will eventually kind of get to that point. But just to I'm a slightly more positive as well. I think one of the latest sort of industry reports identified the UK as one of the fastest growing markets in Europe, kind of after Germany. Germany is obviously kind of much further ahead than we are, but I still think compared to other countries in Europe, we have made some considerable progress. There's obviously just a lot more untapped potential.
So I'm terrible because I'm hopeful, but I am also very disappointed at the progress that we've made. I'm sorry, I'm a straight shooter, so I'm just going to be honest. But okay, so initially you said 140,000, and I thought, oh my God, we have made some progress. That's better than I realized. And then you said 30 to 40, and I thought, what? And my heart sank because while researching for this presentation or podcast, I was looking at figures, and I'm a pain patient, so I was looking at pain figures, yeah. And okay, I'm just going to read something that I wrote that I jotted down from before. So from a pain perspective, right, roughly 34%, that is 15.5 million people in the UK are living with chronic pain. And out of those out of those 15.5 million, 12%, that is 5.5 million of them, their pain impacts their ability to carry out day-to-day tasks. So they're living in high impact pain. So bearing in mind, it is 5.5 million living in impact pain, and the NHS only treats 4.6 million a year, which means we are looking at 41,400 people who have unmet clinical need and are struggling to carry out day-to-day tasks. Yeah. So when I hear figures like 30, 40,000, I get very upset because I know what it's like to not be able to even get out of bed to go and pee, as embarrassing as it is to admit. And to think that there are so many other people out there who are struggling the same way I was struggling, trust me, it takes a toll on your mental health. And to think that there is 41,000 people that have unmet clinical needs, and you have medical cannabis here that is literally saving and changing people's lives. Because I don't just believe in, the right to live, which is our human right. I believe the right to live means the right to having a good quality of life. What's the point of living if you don't have a quality of life? You're just a vegetable. So I'll stop my rant now. But
No. I mean, these are all huge. I mean, you talk about it in the context of sort of pain management and pain patients, and again, like you say, that's just one part of this. There's neurological, psychological, use cases as well. And I think in many cases, all of us in some respects could benefit from it, essentially, when you think of it in those contexts. But it's about kind of putting, and I think that's really the beauty of having something like this conference, is that it really opens up the discussion, and like you're saying, people become advocates, and there's so many kind of really good advocacy groups here in the UK, not just aimed at patients, but you've got the MCCS as well, the Medical Cannabis Clinician Society, educating doctors. And it's like all of these parts, and just to kind of wrap up here, is that all of these kind of moving parts are doing their own thing, almost a little bit in isolation, and it feels like something like this is really essential in terms of uniting the community and thinking of it in terms of a community. And I think that's what will really help. I mean, do you think that, Sarah, just to kind of get a final take from you, do you think this is the sort of thing that's needed? And also, what else could we be doing, or what else needs to happen in order to kind of help nurture that community?
Yeah, I mean, I think it's always difficult. It's such a complex issue, and there's so many different moving parts that need to be addressed. Doctors need to be educated. We need the legislation to allow, for example, GPs to prescribe. Obviously, we need NHS access, which is like the most fundamental thing. And none of these are kind of straightforward things. But I do think that the industry does tend to sort of fraction itself off, and there's a lot of kind of people doing good work but sort of independently from each other, and sometimes it's a bit confusing because there's sort of all these different messages, and then there's a new campaign for this and a new campaign for this. And I think, you know, the Cannabis Industry Council has done a really good job of trying to like bring that together. But yeah, and there's just something about kind of when you're face to face with people and you're having those conversations and able to sort of engage with people that does kind of like harbor a sense of community, and hopefully from that, you know, relationships will develop and people will collaborate, and you know, and that does happen, don't get me wrong, like that does happen in the industry, and I think it has improved a lot in kind of the last few years. There's a lot more collaboration between different sort of advocacy groups and stuff. I think there is kind of a bit of a gap in terms of patient advocacy groups at the moment. I don't know if there's kind of you probably can speak to that more, Berta, but yeah, you know, we've seen there is a few different groups, but I think for people who are maybe not already in the community or not already adult use users, I'm not sure if there's somewhere that's kind of obvious for them to go to for support, if you know what I mean. So yeah, I think maybe that could be a really powerful outcome of this event. And yeah, I'll shut up now.
No, not at all. Not at all. No, I think again, for all of the reasons that, you know, this is going to be, I think it's going to be a really interesting day. So I'm personally looking forward to it, and look forward to seeing you both there and hearing your stories and everybody else's at the show. So thank you very much, Berta and to Sarah, and have a good rest of the week, and we'll see you soon.
Thank you.
Thank you so much.
All the best. Thank you. Bye.
Bye.